The federal government does have a playbook for local jurisdictions to prepare for the vaccination to roll out. It's a 75-page document. And actually, nowhere in that document did they mention vaccine requirements. They do have a section where they focus very heavily on communication and targeting messaging to specific populations. So my impression is that the CDC is very much encouraging voluntary programs and communication strategies rather than requirements. Now, when requirements do occur, they almost always happen at the state level or the employer level. And there is quite a bit of precedent, specifically for schools and healthcare settings, to have requirements either by a healthcare employer themselves or a state that requires it of healthcare settings. But it's not clear yet what states will do with regard to this vaccine.
Vaccines can be controversial. So let's say the state of Arizona passes a requirement for the COVID-19 vaccine. It then trickles down into local municipalities. If a first responder frontline worker says, I'm not comfortable, the research is not out as to the extent that I would like to see, that person can decline, but their job could then be in jeopardy. Is that correct?
According to the precedent that we've seen in other settings with other vaccines, that's correct. That if a person doesn't have a disability or a specific medical condition that would warrant exemption, they could decline, but then correct, their job could be in jeopardy. Yet to be seen how that might be applied to COVID-19 specifically, because the safety situation is different for this vaccine. Most likely, it would be approved through an emergency use authorization by the Food and Drug Administration. And that would mean that we haven't studied it as much for safety. So for that reason, my guess would be that states might be more hesitant to pass those types of laws because the safety information is not as clear. But it's yet to be seen, at least from the legal reading that I've done, whether or not the legal precedent might be a little bit different because of less safety information here.
Could the same ramifications apply to schools? Because as we know, children are often required to be vaccinated. How easily could the state now say your child has to be vaccinated against COVID-19?
So schools are a bit trickier. There's a ton of legal precedent with regard to states requiring both public and private schools to have, for children to be vaccinated as a condition of attending school. And that is constitutional with some exceptions in some states. But again, the situation with COVID-19 is a little bit unique. And I would say that it's unlikely for there to be school-based requirements anytime soon during this pandemic. And that's because this vaccine has not been tested in school-age children.
You probably foresee lawsuits coming as a result of this. Is that fair to say?
I think that would be likely, especially since some of this would be unsettled with, the current case law of vaccines.
Okay, so where does this leave us? What are to we expect here in the coming months as the possibility of a vaccine becomes more real for many people?
I think it's most likely that first, jurisdictions will rely on communication strategies and encourage voluntary use of vaccines. I think that we'll see some variance from state to state, and that some states will be quicker to try and require vaccines, and same thing with some employers, but that because we're in such a polarized and politicized environment, it is likely that there will be lawsuits to those requirements. And I also think that we'll see the inverse occur, which would be that we will have limited doses of these vaccines initially. And so you'll see people who would like to get vaccinated who don't have access yet because of a limited supply. And those people might want to pursue lawsuits as well. So it'll be really interesting to see really how many people would like to decline the vaccine, and whether that's a higher or a lower percentage of people than might be predicted.
All right, Professor Kieran Goff, thank you for your time.
Thank you so much.